All right. First of all, I'd like to thank everyone for coming to the Women's Wellness Day. It is my pleasure to be here to talk to you. I hope that I'm able to give you some insight on managing your blood pressure. Now I've got to make sure I can figure out how to work all this technology. So how many people here have high blood pressure? Now, how many people here know what having high blood pressure means? Good, about half. So hopefully when you leave here today, you'll know a little more. So what is blood pressure? Blood pressure is the force of blood against the walls of the arteries. So there's two components. There's the systolic blood pressure, which is what we know as the top number, and that's the force of blood as the heart beats. And then there's the diastolic blood pressure, which is the bottom number, and that's the force of blood on the heart as the heart relaxes in between beats. And we report it as systolic over diastolic blood pressure, so top over bottom. And both numbers are important, and we'll talk about that in a little bit. Hypertension. It's also known as high blood pressure. It's a global problem. There's 70 million Americans that live with high blood pressure, and it's responsible for 7.6 million deaths. Blood pressure increases with age. As we get older, we have higher blood pressure. There are no symptoms. There are no signs. It's the silent killer. So what is normal blood pressure? Ideally, we want our blood pressure less than 120 over 80. And both numbers matter. So if you have a pressure that's 160 over 80, you still have high blood pressure, even though 80 is okay. So the way we classify blood pressure, we treat and classify blood pressure according to different stages. Like we said, normal blood pressure is less than 120 over 80. This is where we all want to be. The next stage is pre-hypertension. This was used to be known as the borderline hypertension. You may have heard that before. This is the in-between categories, like the gray zone. You don't have high blood pressure yet, but you're at risk. And that's when your blood pressure is the top number between 120 and 139 over 80 to 89. This is very important because although pre-hypertension is not a disease category, it's very important because it puts you at risk of developing hypertension. There are approximately 59 million people who have diagnoses of pre-hypertension. This is 28% of the American population. It's important to recognize if you have pre-hypertension so you can take the necessary lifestyle changes to prevent or delay the progression of disease. Now, stage 1 and stage 2 hypertension. This is when you have the diagnosis. Stage 1 is when your top number is greater than 140 but less than 60. So we say 140 to 159 over 90 to 99. This is generally, it happens in stage 1 and then hypertension will progress to stage 2, but not always. Some people can present with stage 2 hypertension, and that's when your top number is greater than 160 or your bottom number is greater than 100. It's important to differentiate these two categories because stage 2 hypertension generally, without exception, requires at least 2 medications. And studies have shown that it's better to actually take lower doses of 2 medications than to take 1 medication at higher doses because you eliminate some of the side effects of taking the high dose of 1 medicine. So you're able to take 2 at lower doses, and it's a lot safer. So what do we know about blood pressure? We know that as we get older, our systolic blood pressure, or our top number, increases. So we see here, this is blood pressure going up, and then this is as we get older. So the systolic blood pressure increases as we get older. And I mentioned earlier, both numbers matter. The older you are, the more likely you are to have isolated systolic hypertension. That means just the high top number. This is very important to recognize because a lot of times this can often go untreated because people think that it's only a little elevated. So we need to be diligent about getting our blood pressure checked. So I said the older you are, the more likely you are to have high blood pressure. This study showed just that. This is a prevalence of hypertension by different age groups. We see here that from age group 18 to 34 on to the over 75 age group. And what's interesting is that look at the over 75 age group. The bluish green turquoise represents men. 68% of men over the age of 75 have high blood pressure. And look at the red. 84% of women over the age of 75 have high blood pressure. This is very important. There are over 65 million adults with high blood pressure. So why is high blood pressure important? We said it's the force of blood against the walls of the arteries. It's a major contributor of heart disease and strokes. The higher your blood pressure is, the harder your heart has to work to pump blood to the organs in your body. Untreated hypertension can cause the heart to enlarge and lead to congestive heart failure. High blood pressure causes damage to every organ in the body. So this is a little diagram of all the different organs that high blood pressure can affect. So if we start with the heart, in response to high blood pressure, the heart is just like any other muscle, gets bigger. So it's having to work harder, so it gets bigger, it gets thicker. This is not a good thing. This is not like you're working out and you're building muscles. You don't want to build muscles in your heart. This is what's known as remodeling. It's not like you're remodeling your house and you're getting a new kitchen and it's good. Remodeling is a bad thing when it comes to the heart. Remodeling occurs when the heart changes shape to meet the needs of the higher demand that your body, that it's being put on, the higher stress level that it's being put under. This thickening and enlarging of the heart can lead to weakening and lead to congestive heart failure. In fact, it's one of the top 2 causes of congestive heart failure is untreated high blood pressure. In the brain, high blood pressure can lead to bleeding in the small arteries that are in the brain and lead to a stroke, or I'm sure you've all heard of people who are having bleeds in the brain due to their pressure being so high. In the eyes, high blood pressure can damage the nerves that are responsible for vision and lead to blindness. In the kidneys, it can damage the cells that are responsible for the filtering ability of the kidneys and lead to kidney failure and the need for dialysis. High blood pressure puts undue stress on the aorta, which is the major blood vessel that takes blood away from the heart. And this can lead to the aorta becoming dilated and forming an aneurysm, and if ruptures, can cause death. High blood pressure also promotes atherosclerosis. And this is, we heard of the hardening of the arteries or the plaque buildup. And this is due to all that extra force being put on the arteries. The arteries harden and develop plaque. And plaque is what's responsible for the narrowing that we have when we have blockages in the arteries of our heart. And it can lead to heart attacks and strokes. So depending on what organ it is, high blood pressure affects every organ in the body. So it's important to recognize that and treat it. So why should we treat hypertension? This slide shows the incidences of high blood pressure versus and the incidence of death, heart attack, stroke, etc. So if we look at the red line, which is optimal blood pressure, those are patients who have blood pressures less than 120/80. The next line, which is the grayish line, is those who have 120s to 130s. And the blue line represents the prehypertension stage, which is 130 to 140. And look at this. In women, there's a 5.3% increase in mortality, even with prehypertension. And in men, it's a 6% increase. So these aren't people who even have a diagnosis of high blood pressure. These are people who have prehypertension. So that just goes to show you how important it is to treat it early. So why should we treat hypertension? Because lowering blood pressure is important at reducing our risk of cardiovascular disease. Clinical trials have shown that treating blood pressure with medications is associated with significant reduction in heart attacks, a 20 to 25% reduction in heart attacks. There's not many things that can cause that much of a benefit. Heart disease is the #1 killer of the human race. And if we could cut our risk of heart attacks by 25% by managing our blood pressure, that's huge. Stroke. It decreases our stroke rate by 35 to 40%. And heart failure by over 50%. So each 20 point increase in your top number, or each 10-point increase in your bottom number, doubles your risk of cardiovascular disease. the same token, every 20 points that you decrease in your top number, or every 10 points that you decrease in your bottom number, you cut your risk in half. So treating high blood pressure is very important. When evaluating hypertension, it's important to identify what other medical conditions you have. You need to, do you have high cholesterol? Do you have diabetes? Have you ever had a stroke? All these are important because they affect how you treat it and what medications you use. You need to assess other risk factors. Are you overweight? Are you getting the amount of exercise you need? Examine the lifestyle conditions. Are you adhering to a low-salt diet? Are you taking your medications? And also it's important to identify any specific causes of hypertension that you may have. While most hypertension happens for unknown reasons, there's no absolute reason that we can fix. It just happens. There are some causes of hypertension that are due to treatable causes, and it's important to identify those to get the necessary treatment. So this is the little flowchart or algorithm that we use to start treating hypertension. And it's long and complicated, and you don't have to memorize it because I don't even know it. But what I like to point out is that treating hypertension begins with a little TLC, and that's therapeutic lifestyle changes. Therapeutic lifestyle changes can help lower your blood pressure. Regardless of what medications you're on, regardless of how high your blood pressure is, everyone should have some TLC because it could reduce the number of medications you have to take or possibly prevent you from having to take more. So with regards to TLC, what can we change? Tobacco use, obesity, physical inactivity, salt and alcohol intake, healthy diet, and stress levels. Smoking. Smoking is the #1 preventable cause of death in the United States. Again, cigarette smoking is the #1 preventable cause of death in the United States. And while cigarette smoking does not directly contribute to high blood pressure, it does promote atherosclerosis, which is that plaque buildup. Cigarette smoking increases your risk of heart attack, stroke, and death by 10 times that compared to those who don't smoke. With the amount of information we have on cigarette smoking, it still amazes me how many people continue to smoke. You must take control of your own life. Ask your doctor for information on quitting smoking. It will save your life. If you take home nothing from this presentation, remember that smoking is the #1 preventable cause of death in the United States. Obesity. Obesity is the #2 preventable cause of death in the United States. It's a major contributor to the development of high blood pressure, heart disease, and stroke. Obesity is directly related to all of the preventable diseases that we have. It has been shown over and over again that if you're obese and you lose the weight, you'll reverse the medical conditions that you have. If you have high blood pressure, high cholesterol, diabetes, and you lose the weight, those medical conditions go away. So it's largely preventable. There's not many things that we can change in our life. We can't change the fact that we're female. We can't change the fact that we have a family history of heart attacks. We can't change the fact that we're getting older. We can change this. Remember, obesity is a lifestyle choice. Everyone can lose weight. It's not a hormonal problem. It's not a medical condition. It's simple as the calories you eat, you have to burn out. If you're eating more calories than you're burning off, you will gain weight. Body mass index. This is an estimate of your body fat based on your height and weight. The higher your BMI is, the greater likelihood you are to develop conditions like heart disease, diabetes, high blood pressure, and sleep apnea. So this is the BMI chart. Hopefully y'all can see it. If not, you can get it on the internet everywhere. You take your height on this, you find your height on this column, and your weight on the top, and wherever you fall is what category you're in. You're considered overweight if your BMI is greater than 25, and obese if your BMI is greater than 30. And then you get to extreme obesity, which is morbid obesity at BMI is greater than 40. Physical activity. We must get active. The American Heart Association recommends 30 minutes of moderate intensity activity on most, preferably all days of the week. This is 150 minutes of activity per week. If you want to lose weight with exercise alone, they say that you need to exercise between 60 to 90 minutes on most, preferably all days. This seems like a lot, and it is, but you have to find time to do something that's so important and has so much benefits to your body. Whether it's taking the stairs instead of the elevator or parking a little further away from the grocery store, we have to try to take small steps that we can. And when we first start exercise, we won't be able to go for 30 minutes, and that's fine. But you go 5 minutes, or you go 3 minutes. Go as far as you can, and the next day you go a little further. And then with time, you'll make it to the 30-minute or the 60-minute recommendation, and you'll feel better. So this is a nice little count. I'll go back. All right. Let me get some water. So salt intake. Very important way to treat high blood pressure, and actually pretty easy once you get down to it. The average American eats greater than 5 teaspoons of salt each day. Now, while everyone's probably saying, I don't put that much salt on my food, if you live in Louisiana and you cook Louisiana food, you eat 5 teaspoons of salt a day. If you eat canned foods, if you eat out in restaurants, these pre-mixed salad dressings and marinades, they're full of salt. This 5 teaspoons a day is greater than 20 times the recommended amount. We have to eat less salt. If Americans cut their average sodium intake by more than half, it'd be a 26% decrease in high blood pressure and a savings of $26 billion in healthcare costs over just 1 year. So this is how most of us are. So tips to a low-salt diet. We have to stop adding salt to our food. It's very important. I like to tell people we take the no-salt diet approach because you can't do low salt. If you try to do no salt, you may end up getting low salt. So you have to stop adding salt to your food. And if you're cooking, don't cook with salt. There are other things that you can do to help. Experiment with other spices. Some of the fresh spices, basil, oregano, you'll get other seasonings, and eventually your taste buds will change. Use lemon juice or lime juice or even vinegar to your food, because sometimes you just want the tang, and that people think that's salt that they need, and if you squirt a little lemon juice on and eat it, that'll satisfy the tang that you're really craving, and then it's no salt. You need to avoid seasoning mixes like Tony Chachere's, Season All, Slap Your Mama, because those are full of salt. Make your own seasoning mix. Get garlic powder, red pepper, black pepper, and whatever other seasons you like. Mix it all together. Just don't add salt, and then you could use that, and it'll be a one container, and season all your food with it. But just cut out the salt. Like I said, salad dressings, marinades, sauces, they're full of salt. We have to be aware of hidden salts. Canned or processed foods. This is a big one, because a lot of us eat a lot of canned vegetables and whatnot, and they're full of salt. Fresh or frozen options are much, much better because you can control the amount of salt in it. If you eat out a lot, you should try to prepare your food at home, because then you could control it. But if you do eat out a lot, ask for low salt options. A lot of times they're available, and the chef will be happy to make them for you. Ask your doctor about salt substitutes, such as Mrs. Dash. I wouldn't say they're necessarily recommended for everyone, because depending on your kidney function and whatnot. Just ask your doctor if they're safe for you, and he or she will be able to tell you. Stick with it. Your taste buds will change. It will adapt, and you'll find yourself eating less salt. I did this myself because I'm always telling my patients, eat less salt, eat less salt. So I went 2 weeks. I'm like, I'm not going to add any salt to my food. I'm going to be diligent about it. And it was like in the summer, and I love tomatoes. Tomatoes without salt aren't so good. But I did it. I put black pepper and I put lemon juice, And now I don't ever add salt to my tomatoes. So your taste buds do change, and then when you do eat salt, it'll be terrible and you won't like it. Read labels. Reading labels are very important. Pay attention to the serving size, because sometimes you'll have something that looks small and you're like, oh, this has to be a serving. When you look at it, and it's really 4 servings. So if you do eat the whole thing, you have to multiply it by 4. Less than 5% sodium is what we consider low salt. If it's got greater than 20%, it's high. If you're not sure and you just want more information on nutrition, ask your doctor for a referral to a dietitian or a certified nutritionist. They can really help. This is a laundry list, but this is some examples of low salt herbs, spices, and seasonings on this side. And the other side is some examples of some high salt seasonings, what we should avoid. So as you can see, basil, bay leaves, celery powder, all those are great. Lemon juice, vinegar. We should avoid anything with the word salt in it. Garlic powder's fine. Garlic salt, not fine. Onion powder's fine. Onion salt, not fine. So just important to distinguish between the two because they are different. A lot of these meat tenderizers, pickles, relish, full of salt. Mm-hmm. So that is good. That's why I said just check with your doctor to make sure you don't have any like kidney problems or things like that to where a diet too high in potassium could be bad. So if you don't have any underlying medical conditions, that's probably great. But if you are on medications for your blood pressure, just ask your doctor since he'll be able to tell. Because some, depending on what medications you're on, you may not be able to take the extra potassium. This is some examples of some low salt foods that are good, and then of course the high salt foods. Important to point out, a lot of our processed meats, bologna, ham, corned beef, full of salt. That's canned tuna, canned chicken. Pretty much any canned food is going to be full of salt. That's how they can can it. They preserve it in salt, right? I can probably get them I'll have to ask someone. You can Google it. That's what I did. But I'll see if they can maybe post them. Should have brought copies. All right. So we talked a little bit about a healthy diet. A healthy diet should consist of fruits and vegetables, whole grains, high fiber, fish, especially the oily fish. As a matter of fact, it's recommended that fish should be eaten 2 to 3 times per week. There's a lot of literature out there on fish oils preventing everything from heart attacks to strokes to abnormal heart rhythms. So in the next few years, I anticipate there's going to be a lot more on this. So fish, very good. And of course, eating less than 2 grams of salt per day. A diet low in saturated fat, low in calories, and obviously low in cholesterol. And you just limit your alcohol intake. Chronic stress. How many of you here have stress? So, chronic stress is very important. We must try to avoid stressful situations if possible. I know this is not always the case. Work, family, especially as women, they put a lot of demands on us. So you have to try to take control of your life. Believe it or not, exercise truly helps. You heard of the runner's high or endorphins that circulate. It truly works. It doesn't mean you have to be a marathon runner to experience it. If you get into a daily exercise routine, I guarantee you after a week you'll feel better and you're like, extra energy. And it's, you get home from work and you're tired and you don't want to exercise, make yourself do it. And I'm guilty of it as well. Make yourself get on the treadmill, walk outside, walk around the block because you'll feel better and you're like, oh, I feel great. And that actually lowers your stress levels. Meditate, relaxation techniques, yoga. I'd like to mention the Inner Heart Study, which was a study that was done that looked at different risk factors in women and the risk of heart attack, dying from a heart attack or stroke. And chronic stress was third only to cigarette smoking and high cholesterol as a major contributor to heart attacks. So chronic stress sets the stage for and increases susceptibility to acute events, acute heart attacks, acute strokes. So we must manage our lives. I mean, we must manage our stress lives too. So with regards to TLC, this is what a little therapeutic lifestyle changes can do. So this is the blood pressure on this side, and then these are the different therapeutic lifestyle changes that we have. So if we combine a 19-pound weight loss with a low-salt diet and exercise and a decreasing in how much alcohol we intake, we could get a 20-point reduction in our systolic blood pressure, or our top number, and a 10-point reduction in our bottom number. This is very important because I showed you earlier that for every 20 points that you decrease your top number, you cut your stroke risk and your heart attack risk in half. So we should all engage in a little TLC. So back to this little chart. So when therapeutic lifestyle changes fail to meet our desired blood pressure goals, we have to turn to medications. So the type of medication that you're on for your high blood pressure depends largely on what other medical conditions you have. So these are some of the compelling indications that would make your doctor choose one medication over the other. If you've ever had heart failure or a heart attack, there are certain medications that in large clinical trials and in guidelines have shown to work better. For instance, if you have kidney disease, you know, the ACE inhibitors and the ARBs, that's your lisinoprils and your monoprils, all the prils, have been shown to work better. So that just kind of shows you why your doctor chooses one medication over the other. And if you don't have any of those compelling indications, generally for stage 1 hypertension, a fluid pill works the best. And typically we use hydrochlorothiazide. These are the thiazide diuretics. Out of all the other drugs, the more expensive ones, this has been shown the best, to work the best. ACE inhibitors and ARBs are also good as monotherapy, meaning only taking one drug. It's important to point out that look at stage 2 hypertension. That's the people who present with pressures greater than 160 over 100. They almost always need 2 drugs or more to control their blood pressure. And it's usually a fluid pill in combination with something else. And that something else, you know, kind of depends on some of which is your doctor's preference for prescribing, but like I said, he'll look at other conditions that you have to help choose. So this is an important graph, and it's pretty in color, but I'll explain it to you. This is the ALL-HAT study. This looked at, it's the multiple antihypertensive agents needed to treat high blood pressure to achieve the blood pressure goal. So this looks at the progression of disease from 6 months, 1 year, 3 years, and 5 years. And as you can see that the longer you have high blood pressure, the more chances that you are going to be on more than one drug. Part of this is because we're getting older, and as you get older, your blood pressure gets harder to control, but other factors play into it too. So just don't be surprised if you're on more than one drug. It's not a bad thing. Sometimes it works better. So what is adequate blood pressure control? Less than 140 over 90. Now, if you have diabetes or chronic kidney disease, we'd like to get your blood pressure less than 130 over 80. But is lower better? How low should we go? Is getting our blood pressure lower than this what we really need, or is this good enough? Well, the ACCORD blood pressure trial looked at just that. They took intensive therapy, so this is having patients and putting them on medications to get their blood pressure less than 120, versus standard therapy, meaning we'll just treat you to less than 140 because that's technically at goal. So the blue line is standard therapy, and the red line is getting your blood pressure down to less than 120. And this is how many events. As you can see, there's a nice separation of curves. In fact, it showed significant improvement. Number needed to treat is a way that they look at to see how many people you need to treat to get a benefit, and that's actually a very low number. So this study showed that treating your blood pressure to less than 120 is probably where we need to be, and not just the 130. This study showed significant decreases in stroke, death, and heart attacks, and that's what that graph shows. So what about the elderly? Should we treat high blood pressure in elderly? And the answer is yes. This study showed that you can reduce your total mortality, so that's your risk of death, by 13%, your cardiovascular death by 18%, stroke by 30%, and heart attacks, which is coronary events, by 23%. So important information. So you're not too old to get blood pressure treatment. What about the very elderly? So it was once thought that once you're 80s and 90s, if you had high blood pressure and you'd never had high blood pressure before, but your doctor checked it and it was a little high, they just let you go. It's okay, you're 85, you're fine. So this study looked at that. This is patients greater than 80. And look at these graphs. I know it's a lot of information. But this is the stroke. The blue line is the placebo group. So these are 80-year-olds and older who were not on blood pressure medicine. And the red line is 80-year-olds who got their blood pressure treated. And you can see there's a clear separation in the chances of stroke, the chances of death from any cause, the chances of death from heart causes, death from stroke, and then look at heart failure. Look at that separation. That's huge. It's a huge difference. And heart failure is very important as we get older. Because of our arteries, they get stiffer and the heart gets weaker because it's an 80-year-old heart or a 90-year-old heart. So controlling blood pressure is very, very important, even in the very elderly. So you're never too old. So just to summarize, hypertension update, 2012. Hypertension has a tremendous global burden. There are no signs, there are no symptoms. It's the silent killer. The prevalence is increasing with the obesity epidemic. We have to change. We can change this, just a little effort. Controlling your blood pressure can significantly reduce your cardiovascular risk. A little TLC can go a long way. Multiple medications are often needed. Intensive blood pressure control may be better than standard therapy. And even the very elderly benefit from therapy. Okay, so there's no such thing as too low of blood pressure unless you're symptomatic. So I have a blood pressure that's very low. It's like 90/50. But I don't have low blood pressure. My blood pressure is just low. Now, if you take someone who has a blood pressure that normally lives in the 160 range, and I brought their pressure down that low, they would feel dizzy and passing out, and they would feel terrible. So low blood pressure depends on symptoms. So if your blood pressure runs 100 and you're fine, and you're not getting dizzy or passing out or all that, then that's great. The lower the better. So right, well, you have to make sure there's not other causes, but yes, if sometimes that's one of the symptoms that they're treating your blood pressure to too low of range. But just arbitrarily calling a number too low, we don't generally do that because we look at the patient. If the patient is walking and talking and feeling great with a pressure of 100, great. Not always. It's not always the case. Some people feel bad at a pressure of 130. So